We do follow-up with patients before they go home. A week before, we start talking with them about their home program. That's very individual, depending on the case, of course. So the treating doctors start talking with them. We have a meeting every morning at 9 o'clock in the morning here with all the doctors and the staff where we talk about each patient and we define what we're going to send them home with, depending on each case. So, yeah, everything is decided as a team. Obviously, I have the last word, and then it's explained like a week before patients are discharged. And then when they go home, we follow up with them. So we are calling them periodically, or also they leave with all the information to contact us if necessary.
Welcome to the Beljanski Cancer Talk Show, where integrative science and holistic healing come together. I am Sylvie Beljanski, and in each episode, we explore nutrition, lifestyle, mental health, and research-backed approaches to support the whole person through cancer and chronic diseases. Hello, and welcome to the Beljanski Cancer Talk Show. I am very excited to be with you today and to introduce you Dr. Carlos Bautista. Dr. Carlos Bautista is with the Immunity Center. It's a beautiful clinic in the area of Tijuana, Mexico, and one of those clinics that are very well known and bring different kind of hope for people here in the States by offering things that they not always find in the States. And I understand that for some, it can feel like a little bit scary to get outside of the United States. But the Immunity Center in Tijuana has long record of safety and efficacy. So I thought I should share with you this information, and welcome today, Dr. Bautista.
Thank
Hello.
you. Thank you, Sylvie. Hi. Thank you for having me. And yes, we are here in Tijuana Immunity Therapy Center, and we've been here for some years now. And yeah, like you mentioned, we have state-of-the-art facilities and newest and most successful alternative and immunotherapies. Yes.
Yes. So for how long has this clinic been created?
Well, we started very small many years ago, and back in 2006, that's when I opened Immunity Therapy Center.
That's 20 years.
Yes,
That's
20
kind of
years
an achievement.
actually.
20
Yes.
years, yes.
So, well, before that, I worked in other places, but then I decided to open my own clinic. It was very small, and then, well, we started to have, thank God, success treating patients, and we grew from there. And now we have an 8-story building where we have all the facilities where we can give treatments that are needed, from surgeries to alternative treatments to immunotherapies. And well, we'll talk a little bit more about specifically what we do, but yeah, it's been already 20 years.
Yeah. So tell me about you. You are saying, grew with the success, which is always good. That's what the patients want to hear. What is the recipe behind the success of your clinic?
Well, first of all, the human part that we always trying to find a solution. We don't stop until we get a good response. And that combined with state of the art equipment and facilities and devices and having the best doctors and the dedication to, in a very individual manner, to each of the patients that come to us. I think that's the recipe for the success that we have for these years.
So tell me more about, this thing about making sure that the experience of the patients who come to you.
Well, first of all, we offer treatments that are not available in the United States or in other parts of in Canada or in Europe.
Like what? Like what? Can you give
Like
me some examples?
the immunotherapies, the alternative treatments that we do, the different venues.
Can you describe those alternative treatments?
Yes, we have our treatment divided in 5 pillars mainly. The first pillar is immunotherapies. The second pillar are alternative therapies. The third pillar is intravenous solution. The fourth pillar is oxygen and oxygen therapies. And the fifth pillar is nutrition.
Okay. So,
Our first pillar, immunotherapies, are different treatments that we do have here that are going to stimulate in different ways the immune system to detect and destroy cancer cells. As you know, one of the main problems that happen is that immune system does not recognize that a cancer is growing. So we have to teach the immune system to recognize and give the weapons so they are able to destroy the cancer cells. We do that through different procedures like mononuclear cell activation, like application of different antibodies that we have available here. The second pillar are the alternative treatments where we do therapies that work really well in combination with the rest of the pillars, but mainly we're talking about whole body hyperthermia, local hyperthermia, rife treatment, biofrequency therapies, halotherapy, which is a biofrequency therapy as well, and mainly ultraviolet blood irradiation treatment. So it's a combination of different therapies that are going to synergize with one another to maximize the effect. So we try with these alternative therapies take advantage of cancer cell weaknesses and use that to our advantage, to destroy those cancer cells. Or third pillar will be the intravenous solutions where we use these are customized to each patient depending on their need. We have everything available for methylene blue to B17 chelation, well, all type of intravenous solutions. Or fourth pillar, which is the oxygen treatments. As you know, oxygen is very necessary. A rich cancer cannot grow in a rich oxygen environment. So we use hyperbaric, we use therapies, we use hydrogen peroxide, we use ozone therapies, we use different ways to hyperoxygenate the body to create an environment where cancer cannot grow. And our fifth pillar will be nutrition. As you know, cancer feeds on sugar. So we are using here in our center a low glycemic index diet where we are definitely making sure that the cancer is not receiving the food that it needs to grow.
okay.
So those
Sounds
will
good.
be your five pillars in a nutshell, Sylvie.
Yeah. Do you use chemotherapy also?
Yes, but in a very different way than conventional. We have
Okay.
a therapy that is called DPT,
Mm-hmm.
where we stands for DMSO potentiation therapy. And this DMSO will carry whatever medication we use in a low dose. Normally we use 10% to the cancer site. So that's the main way that we use the chemotherapies here. With this method, you won't have any side effects or any bad reactions because of the low dose that we use, but we are able to maximize that low dose by directing it only where it's needed. And the therapy is called VPT.
Excellent. So generally, I mean, people are coming down to Tijuana and they are staying at the clinic and they are taken care of? Or is it like, I mean, inpatient, outpatient? What is the
Yes.
protocol?
We have different programs and we are a full certified hospital, Sylvie. We have an inpatient program where patients that cannot move too much or they are in a compromised situation and they need constant care. We have that patient here. That's the inpatient program. The majority of our patients come in at the outpatient program, where they stay in our facilities where our patients stay, which is some apartments that we have where they can stay, or sometimes they can stay also in hotels or areas that are around or center, but we prefer that they stay with us because we can control transportation and their times and everything. So usually that's how where they stay.
And generally, what is the typical length of the stay?
Normally, we request patients to come for a 3-week program, but usually they stay a little bit longer, depends on each case. But to begin with, we request patients to come for a 3-week program.
And what kind of accommodation do you have for companions that would travel with somebody who is sick?
Yeah, the accommodations that we have, well, they can stay in the apartments, but here in the hospital, I want to make a parenthesis. You're gonna come here in the meeting that I will be presenting at the Beljanski in June. I will be presenting, and after that, there will be very selective clinics that you're going to visit, and they will be able to see the areas where companions can stay. We have a very nice facility with patios and areas where companions can stay during the day when their relatives are doing treatments. So yeah,
Yeah,
we have a very nice dining room where you're going to have lunch when you come to visit us in June. So it's very nice areas.
very good. It's important, yes, that for companions also. It's already so difficult to accompany somebody with a loved one who is sick.
Yes.
Yes, I mean to offer a minimum also of comfort for
Yes.
the companion.
Yeah, we always recommend that everybody comes with a companion so they're not alone, and we have special areas for companions. Definitely.
So you were mentioning that you are coming to present the Beljanski Cancer Conference in San Diego, and we are very appreciative of your presence and very much looking forward to your conference. What are you planning to speak about? I mean, those 5 pillars?
Well, yes, I'm going to talk a little bit about my personal history, why I do this, which is and I'm going to also talk about specifically the treatments and the 5 pillars that we have here, and we're going to present the facility. So hopefully will be a good talk, and I can transmit the message of what we do and why we're being successful dealing with this serious cancer diagnosis.
So I'm sure that, I mean, your success comes also from your passion, and your passion comes from your why. So tell us a little bit, since you mentioned that, why are you doing that? When you are facing cancer, you are suddenly facing a myriad of questions. Questions about nutrition, lifestyle, mental and emotional support, and how integrative approaches can work alongside conventional care. The Beljanski Integrative Cancer Conference brings the conversation together in one place. From June 26 to 28, join leading oncologists, integrative physicians, researchers, and survivors in San Diego, California for 3 days of science, informed whole-person cancer care. These live events explore evidence-based integrative strategies, emerging research, and practical tools you can apply immediately while connecting with a community that understands the journey. Whether you attend in person or virtually, this conference is designed to educate, empower, and support informed decision-making. Learn more and reserve your spot at integrativecancerconference.com. Because better outcomes begin with better conversations.
Well, when I was almost graduating from medical school, this was 1997, 1996. My dad unfortunately was diagnosed with lung cancer, a small cell lung cancer, and when we realized that he was with the cancer is because he had a seizure, and it was already in the brain. So back then I went to my teachers and some of my friends, and he went through chemotherapy, he went through radiation full dose, and he died within 2 or 3 months. He didn't last long at all. And that's when I realized that definitely something else was needed for those type of patients, because it was really no hope, when something like that happens. So that's when I decided to start researching, working in some other hospitals that were practicing alternative medicine. So then I started learning more, and then I started traveling to other countries like Cuba, Germany, and those other countries that had a little bit more experience with alternative treatments, and I learned about them, and I organized this program after some years. And my best reward is when I see a patient in a serious conditions that we're able to help and put in remission. That's my best reward. So that's the reason, Sylvie, why I do what I do.
That's a beautiful story, and definitely a nice tribute to your father. And I'm sure that he's very
Yes.
proud of what you have made of your suffering and your pain. Absolutely.
Kind of similar to your story. I was reading a little bit about your motivation as well, and it was kind of similar, right?
Yeah, yeah. So and now I mean you have this clinic. I mean you went from a difficult time with your father to building a clinic, right? This is pretty amazing. So on the Monday, June 29, I believe, the Monday
Yeah.
after the conference.
Monday, June 29th. Yeah, I
Yes,
have the calendar here.
we are organizing a little tour for 50 people who are buying their tickets now because it's already filling fast. And those people will have the opportunity to visit your clinic.
Yes.
What do you think is going to, I mean, what do you plan to show them that will really, you think is going to capture their attention?
Well, there's many things, not only one. First, that we have state of the art facility, but also they will see how well organized we are as a team. I think that's also very important that I emphasize that it's not only me. I have a very good team of doctors and nurses and administration and kitchen, and everybody gives their best. And I think they're going to get or feel the warmth that we put into every patient. I just want them to know us, and for them to know that we are a possibility, an option. Hopefully not, but if they have the need for something like this, that we are their first option.
When you are facing cancer, the choices can feel overwhelming. Conflicting advices, endless options, and very little clarity. At Maison Beljanski, everything begins with science. For decades, molecular biologist Dr. Mirko Beljanski studied how specific plant extracts interact with cancer cells, work that continues today through independent research and real-world use. Maison Beljanski offers carefully formulated supplements inspired by that research, along with targeted support for immune health, cellular resilience, digestion, detoxification, and overall wellness. You will also find educational books, organic teas, personalized health coaching, and wellness programs designed to support the whole person, not just the diagnosis. This is not about quick fixes. It's about informed choices, thoughtful formulations, and supporting the body alongside conventional care. Explore the products, the research, and the resources at maisonbeljanski.com, because when science leads, wellness follows. Yeah. How many patients do you have on a average time in the clinic?
Normally, we have between 25 and 35.
Okay.
And that's the amount of patients that we feel comfortable treating at one time. That's how everything is designed, to give the best service.
Yeah,
The ratio.
I like that, the fact that it's not a big hospital where you feel anonymous and just a
No.
number and the protocol. Yeah.
No, not at all. We want, like I mentioned to you, we want to make us individual and customize the treatment as possible. For that, sometimes we were like with a little above 35, but we don't feel comfortable. So we try to be between 25 and 35. That's where our staff feels comfortable and where everything works well. A little bit more than that, sometimes we're overwhelmed that we don't like it.
And you were speaking of nutrition. I mean, and I understand it's one of your pillars about for feeling, I mean, to heal. Can you give us a little bit an idea for people who have, nausea? And do your patients have nausea? If they have almost no chemotherapy, I assume they
No,
don't. So they
no.
are able to appreciate the delicious food that you are giving at, I mean, having in Mexico, right?
Yes. Well, we have very Aaron, one of our head chefs. He specializes in this type of food, and you're gonna, when you visit us, you're gonna have a little bit of a taste for what we prepare here. But yeah, we serve everything with organic, organic vegetables, and everything that we do here is without any additives and like I mentioned, we try to make it as low glucose index as
Mhm.
possible. We have our nutritional department here. We have our nutritional department that sees everybody. Also, at the same time, we have to make sure that the patients are receiving the amount of calories that they need because we don't want them to lose
Mhm.
weight or more weight. Sometimes they come very depleted. So each case is customized as nutrition goes, but again, following the guidelines that we have with a low glycemic index diet. But patients love the diet. That's one of my, when the patients qualify us at the end or we ask for their opinion, they always tell us that our kitchen is one of the best that they've tasted. So it's not an easy thing to do to combine good taste with what we're trying to do, but Aaron, he's doing a very good job.
Okay. Can you tell us more about the kind of diet? I mean, is it all vegetarian? Is it, do you include proteins?
General, we want to do a low glycemic index diet. Well, the glycemic index diet refers that each food will raise glucose to a certain degree. Okay, so each fruit, each food item, each protein will definitely have increased the glycemic index. So we want to keep it between 54 or less, the glycemic index of all food items. And that will include vegetables, that will include different type of fruits, that will include, the thing is that we don't want to deprive the body of nutrients that are needed, but at the same time we don't want the glucose to peak, so there are fruits that have a low glycemic index diet that are not that are giving the nutrients that are needed but are not going to increase glucose level in the blood. So we do serve different type of proteins, meaning sometimes we do organic meat or chicken, so sometimes we do vegetables, fruits, but everything within a low glycemic index diet. We do that because we need to give certain amount of calories to the patients, because also if we don't if there's no good nutrition, also that will depress the immune response. So, and that is being supervised and directed by our nutritional department, and the head nutritionist is Mariana Bolaños, that's her name, and likely you're going to meet her when you come.
When cancer enters your life, the questions don't stop at treatment. You start asking why, what else, and what more can I do to support my body? At the Beljanski Foundation, we believe cancer care deserves deeper answers, answers rooted in science, not in shortcuts. For decades, groundbreaking molecular research by Dr. Mirko Beljanski explored how specific natural compounds selectively target cancer cells while sparing healthy ones. That work continues today through independent research, education, and global collaboration. At beljanski.org, you will find evidence-based resources, expert-led conferences, books, and conversations that explore integrative approaches to cancer and chronic disease alongside conventional care. Whether you are a patient, a caregiver, or practitioner, this is the place to learn, to question, and to think more expansively about healing. Visit beljanski.org to explore the research, attend upcoming events, and connect with the Beljanski community. Because informed choices begin with credible science. I like very much his answer that, he's not leaving out completely any complete group of food, because I think, as my grandmother said, a little bit of everything and not much of anything
Exactly.
is
Yes.
the way to go. She was not a doctor, but she was
Yeah.
she had a lot of,
Well, yeah, one of the
and she lived to the age of 93 without any disease.
yeah. Well, the thing is that we have a problem when patients come and they are following kind of extreme diets, which are good, but sometimes, for example, a cetogenic diet or and definitely that you're depriving the cancer from nutrients. But the problem with restrictive diets is that you're going to lose weight. And when you're dealing with a stage 4 cancer or any type of cancer, definitely nutrition is very important and you need to maintain your weight, to achieve a good immune response. So that's why we very selectively, we know that cancer mainly feed on sugar. So that's a nutrient that we try to keep under control.
Beside nutrient-rich food with low glycemic index, what do you suggest? I mean, for the lifestyle of those people, and tell me, what is the average day of a patient? What does it look like?
Okay. Normally we when they come in, well, they go through all the administrative forms that they need to sign. And normally we have two shifts here. The morning shift is from 8 to 2. They come in at 8 o'clock in the morning and normally their day finish like at 2 p.m. And the afternoon shift, patients come in like around 1 and they finish like around 7 in the afternoon. In those hours, they do the different treatments, the different therapies, one after the other in a treatment area where they treatments will come to them and they have their nurses that are going to provide them. And we provide patients in our packages. We normally include 2 meals, so they have breakfast and lunch, or lunch and dinner, depending on or the times that they're coming in. So it's a very intensive program. We give treatments Monday through Saturday, and they're doing treatments basically the whole time. Yeah.
That's indeed pretty intensive for 3 weeks. I'm sure it's a life-changing experience.
It is, and again, it's very rewarding when they see that they are improving day by day. And I see all the patients 1 or 2 times a week myself. They are seen by their treating doctors every day, and we are in constant communication with them, making sure that they're going in the right direction. We do all the blood work and we do all the blood work needed and testing that are needed. We do have our CT scanner here in the hospital, so also whatever CT scans, and also we have the our laboratory here in the hospital, so everything is done here and we have the results quickly, so that's a big advantage as well.
And after those 3 weeks, what happens to the patient when it's time to go home? I mean, do you offer a follow-up? Is there kind of a program to continue to see you through Zoom or something?
We do follow up with patients before they go home. A week before, we start talking with them about their home program. That's very individual, depending on the case, of course. So the treating doctors start talking with them. We have a meeting every morning at 9 o'clock in the morning here with all the doctors and the staff where we talk about each patient and we define what we're going to send them home with, depending on each case. So, yeah, everything is decided as a team. obviously I have the last word, and then it's explained like a week before patients are discharged. And then when they go home, we follow up with them. So we are calling them periodically, or also they leave with all the information to contact us if necessary.
Okay. And you make some recommendation of supplements, of specific diet?
Yeah. Normally we send them home with some supplementation, sometimes therapies that they need to continue, and immunotherapies that they need to continue. So yeah, so that's how we make the recommendations. Again, it's very individual depending on each case what we recommend.
Of course. I like also the fact that it's not one size fits all, because that's one of the big problems of conventional medicine. I mean, us big
Yeah.
hospitals have one protocol, and then everybody has to fit into the same protocol, whether their cancer cells respond or not to that protocol. And sometimes you are lucky, but sometimes you are not. And
Yes, Sylvie, definitely. Here we know that each patient is different, even with the same diagnosis. So definitely, I agree with that.
okay. So, if you had one thing you would like to say to somebody who has been just diagnosed with cancer and feels overwhelmed and doesn't know where to turn, what would you say to that person?
Well, that there's always hope. One of the first things, unfortunately, in the US is that when you're diagnosed with cancer, they always go to the negative, and they always tell you that there's no hope many times, unfortunately. Want them to tell you there's hope, that there are other treatments, that there are things that work that are non conventional, and to make an appointment to talk with us on the phone, and so we can explain to them what can be done. And we have a lot of testimonies and many years practicing this, and we have the experience and the knowledge to deal with complicated cancer situations. And we do have other programs as well, not only cancer, but we treated all kinds of patients in the same manner.
What are the programs? What are the conditions beside cancer are you also
We
addressing?
have cancer, a program for cancer. We have a program for chronic degenerative diseases, diabetes, high blood pressure, those type of things. For neurodegenerative diseases, Parkinson's, Alzheimer's, ALS. We have the Lyme disease program and infectious disease program as well. We have autoimmune diseases program. We have a stem cell program as well, when we provide umbilical cord stem cells. And we do surgeries here as well when needed. So we do have all of those services available.
I think that's a very, very valuable piece of information. And
Yes.
I am sure also for companions who do not have cancer, I mean, the opportunity to address something else
Yes.
that would concern the companion can be very valuable opportunity to have both of them going back home in better
That
shape.
happens often, actually, when they come in and they see all the things that we do, and they get into a program with us companions. Also, we have dental services and all that. So yeah, we're very complete. Again, in we all the doctors here are certified, board certified doctors, and in the hospital we have a full licensed hospital as well.
Very good. Very good. So, can you tell again the audience where they can find you, the name of the clinic, the website, and how
Well,
to reach out
yeah,
to you?
definitely. Our website is immunotherapycenter.com. And what is the other part of information, Sylvie, that you?
The yeah, so you are in Tijuana. Where are you in
Yes.
Tijuana compared to the? I mean, what is the best way to come
To
to
describe,
your clinic?
we are, if you are in New York, it will be Manhattan. It is the business district of the city. It's just like 5 minutes crossing the border from San Diego into Mexico. Is very close to the border, and it's a very secure area, and very safe. Sometimes what you hear on the news It's not that all true. So yeah, so definitely it's very safe and very close to the border. Also, when you fly to San Diego, we pick you up there and bring you to the center here, to the hospital. So transportation, it will be arranged for patients that want to come to us. And we are located, it's called Zona Rio here in Tijuana. And it's a very nice area.
Very good. Dr. Bautista, we are very much looking forward to seeing you at the Beljanski Cancer Conference this June in San Diego. And you, your team, I know you are coming with a booth. There will be information available. We are going to be treated with your presentation. And then I already know that there is a big group of people who want to come to visit you and visit the clinic on Monday.
Thank you so much, Sylvie. It's a pleasure to have you here in the hospital, and it will be a
Thank you.
pleasure saying hello when I see you in the conference. It's an honor, and thank you for inviting me. I feel
Thank
very
you.
honored.
Thank you for joining us. I mean, it's our pleasure and our own honor. Thank you.
Thank you so much, Sylvie.
Thank you. Take care. Thank you for listening to the Beljanski Cancer Talk Show. If this conversation supported or inspired you, please follow the podcast, share it with someone who may benefit, and leave a review to help others discover these integrative perspectives. For more resources and to see what we offer, please visit beljanski.org.